Hey guys, it's Dr. BT, and let's talk about these hormones of pregnancy. Without these hormones, we could not maintain the pregnancy. We love these hormones, but at times we hate them too. So let's go ahead and talk about them. So the first hormone that we're going to talk about is human chorionic gonadotropin. It's secreted by the trypoblast early in pregnancy. I mean, you guys, this can be super early as early as day 15. So it stimulates progesterone and estrogen production by the corpus luteum. Remember, the corpus luteum was the outside of the follicle or outside of the egg, and it's inside our ovary. And it maintains the pregnancy until the placenta is definitely taking over, is secreting a lot of estrogen and progesterone, and is fully developed by about 20 weeks. It peaks around days 50 to 70. So you can see it here. Here's week 0, 10, 20, 30, 40 of pregnancy. And look how human chorionic gonadotropin, it peaks up really quick. Sometimes it doubles daily. And then it falls out at around the 7th or 8th week. It starts falling out. And by the 10th week, you have like this major decline. And so you can see this is the hormone that we test, and we see it on your pregnancy test. So you can see that this really affects you in the first trimester. And it kind of goes into play with people being a little bit sick. The next one, and this is my very favorite hormone. I don't know if you have favorite hormones, but I do, and it's this one. This is human chorionic. So Madomotropin, otherwise known as human placental lactogen. So let's look at the names of these. So human chorionic, so human comes from the placenta to stimulate your mammos. So it stimulates breast development, or human placental lactogen. So it comes from the placenta, it's human, and it helps with lactation. It's produced by the placenta and the placenta only. So what's very interesting about this one is insulin antagonist. So it makes us insulin resistant, which causes our blood sugar to elevate. And why is that, Dr. BT? Well, that is so that our blood sugar elevates and more blood sugar is pushed over to the gap so that the baby can get it, or AKA the embryo or the fetus. So we think about 500 BC. Today's diet's really, we have terrible amount of carbs, and they're simple carbs like bread and, sweets and all these kind of things. And so we think back to 500 BC when we really had very little calories in our diet and very little carbs. So we really needed this hormone to whatever sugars we ate. So let's think of a tuber or a potato or something like that. It allowed our blood sugar to elevate so that we could push that over when there weren't a lot of nutritional things available for us. Now we have a lot of maternal overnutrition where we eat too many carbs during pregnancy. So it facilitates glucose transport across the placental membrane for fetal use, and this is how our baby grows, is the elevated blood sugar. Stimulates breast development and preparation for lactation. So people say, well, if it's an insulin antagonist, Dr. BT, does it cause gestational diabetes? It can. Sensitivity to this hormone can cause gestational diabetes, for sure. We need to look at another population. Look at the population that already has insulin resistance, and that would be our obese population. We worry about anyone who weighs over 200 pounds and gets pregnant. Of course, this would be, in category of height. So let's say a BMI in the overweight category. We worry that they already have some insulin resistance, because the more heavy you are, or the more adipose tissue, secretes two hormones which cause insulin resistance. And so if you're already insulin resistant going into the pregnancy, so if you're already overweight, blood sugars might be, 90, 95, in that kind of pre-diabetic range, just getting this one particular hormone from the placenta can throw you over and cause you gestational diabetes. You can see how it starts. Here's the first, again, 10, 20, 30, 40. You can see how quickly it elevates, but then it goes sky high between 20 and like 38 weeks. And this is when the baby needs to grow. And so we talk about in the first trimester, really, we just have like some cellular development. We don't have a lot of weight gain. But here we can see that the baby gains a ton of weight in the second and third trimester as this hormone surges right here, allowing for more glucose availability from the mom to be passed over to the gap. The next one is estrogen, and you can see here's 4 weeks pregnant, here's 40 weeks pregnant, and you can see these are the 3 types of estrogen in the system: estradiol, estriol, and estrone. And you can see how those go up dramatically. So it's originally secreted by the corpus luteum, and then of course the placenta starts to take over, stimulates the uterus to provide a suitable environment for the fetus. So we need estrogen. Helps the breast to develop in preparation for lactation. So you guys see this dramatic uptake right here. So at the time of delivery, it's equivalent to about 90 birth control pills. That's how much estrogen's on board. So love estrogen, makes you feel good, supports the pregnancy, but this elevation in estrogen will cause you to have, will decrease fibrinolysis and increase fibrinogen. And that is a risk for a blood clot to the leg, or if that breaks off, pulmonary embolism. So we really worry about after delivery. Right at delivery, when we see these peaks, we worry about DVTs and PEs. Of course, after delivery, when this falls straight back down, we worry about how there can be some changes related to the decrease in estrogen, and of course mood changes as well. Types of estrogen. So endo means inside, exo means outside. So we have endogenous estrogen. Those are the ones in your body, made by your body. Those are estradiol, estrone, estriol, and estrol. Exogenous types of estrogens are ones that we take, synthetic estrogens or exogenous estrogens. They're not made by our body. Those are ethinyl estradiol. These are the ones like are in birth control pills, are in hormone supplementation after menopause. Estradiol valerate, menstrual. And so you guys, these are just wanting you to know the different types of estrogen. Estrogen physiology, sex hormone. And I've already said this, endogenous and exogenous estrogens increase fibrinogen and decrease fibrinolysis. Clotting factors 2, 7, 8, and 10 are increased. And this really, anytime somebody takes a birth control pill, anytime somebody takes a hormone replacement pill in menopause, anytime somebody is pregnant and estrogen goes up, we have risk for DVT and pulmonary emboli. When you add on other risks, such as surgery, if you have a C-section and you're immobilized and you're in the bed for X amount of time, that can make it worse. Hypertension can make the risk for the clot worse. And then, of course, elevations in estrogen can increase growth of cancers, breast, cervical, uterine, ovarian, and vaginal. Most of those are estrogen dependent. Relaxin, which is a cool hormone. It's a hormone it's produced by the placenta. It inhibits uterine activity. It diminishes the strength of the uterine contractions. But you guys, what it does is it allows the ligaments to loosen. So you know that your pelvis is held together by ligaments. And so when relaxin elevates, your ligaments relax, and this causes your pelvis to have room to separate a little bit. Has long-term effect on remodeling collagen. Really important there because your feet are held together with ligaments. And when you get pregnant, it relaxes those ligaments, and sometimes you gain an extra shoe size. And then after the pregnancy, your feet don't go back to the size they were before because those ligaments have been stretched, and sometimes they don't go back. The next one is prostaglandins. Prostaglandins are lipid substances that occur in high concentration in the female reproductive tract. We don't exactly know what they do, but we think that they help with the initiation of labor. We do know that during the time close to delivery. We do like for prostaglandins to be there to hopefully initiate labor. One way of increasing the amount of prostaglandins in the female reproductive tract is the application of semen, because around each sperm, I call them sperm helmets. There's a prostaglandin sperm helmet around each sperm, and really that sperm helmet helps the sperm get into the cervical mucus for transport to the fallopian tube. Well, fortunately, you're already pregnant, and now those prostaglandin helmets can help us go into labor. So, prostaglandins are good. Progesterone, and remember, this progesterone is like a serious hormone. We need that major elevation in the luteal phase to maintain the pregnancy. And you can see, again, 4 weeks to 40 weeks, you can see how it goes straight up here. Straight up here. It is produced by the corpus luteum, like we know, originally, and then the placenta takes over, plays the greatest role in maintaining the pregnancy. So you guys, if we don't have this straight elevation of progesterone, we will not maintain the pregnancy. Maintains the endometrium, which is now called the decidua, inhibits uterine contraction, helps develop the breast cells and lobules for lactation, and is a smooth muscle relaxant to prevent the uterus from contracting, which we want. Now, this progesterone, you can see, it goes straight up like this. And then we always talk about when they fall back down. This one is really responsible for major mood changes after delivery. So progesterone falling can cause us some weepy times, baby blues, and can also cause some postpartum depression. We know that with, at the end of our cycle, when progesterone and estrogen falls, we have PMS, but you can only look at the elevation differences that after you have a baby, it's like PMS, times 100 because of how high these are, and then they fall. Progesterone, 6 hormones, endogenous and exogenous. Again, we can have them inside our body, and then we can take them. We take supplementation. Physiology prepares the endometrium, so we know we need it for the pregnancy. Exogenous slows the GI system. Endogenous, that's one of the big side effects of progesterone, is it slows GI, causes nausea, vomiting, constipation throughout the pregnancy. So that's one of the things, that goes with pregnancy. Exogenous risk can cause asthma attacks. And then, of course, if it's progesterone dependent, it can increase the growth of cancer. Of course, these are hormonal receptor cancers: breast, cervical, uterine, ovarian, and vaginal. That's it. That's it for hormones for now, you guys. We'll talk more about them later, but this is just our entry point into hormones. Thank you.